Here we go.
Stand by just one moment.
Okay.
Okay, yep, we're live.
Good morning, everybody, and welcome. It is Wednesday, July 27th, 2022, and this is the weekly public business meeting for the Lincoln County Board of Commissioners. The meeting is being streamed live on YouTube and will be available after the meeting on the county website through our YouTube channel. Commissioner Hunt has an excused absence today, but Commissioner Jacobson and I do constitute a quorum. So the first agenda item is adoption of the consent calendar. These are items that are routine or have been discussed at previous meetings. Is there any item that staff or commissioners would like to either highlight or remove from the calendar?
Okay, I don't see anyone wanting to discuss anything, so I'll make a motion that we adopt the consent calendar as it is presented today.
I'll second that motion. All in favor, please say aye.
Aye.
Aye, and the consent calendar is approved. Next up, a decision action item, federal government indirect cost allocation plan for Lincoln County for fiscal year 22-23. Who is presenting on that?
I think
It would be Christine Sheriff.
it would be the sheriff.
No,
Christine.
Finance Director.
Was she told about the meeting?
Let's double check and see if she's here. She's not online right now.
Was that on a discussion item previously?
I don't remember
think
seeing
so.
this.
Submitted the application.
We can move on and come back.
Exactly.
Yeah.
Chelsea,
Okay,
can you look into that?
we'll move on to our discussion information items. And first up, Lincoln County bilingual pay policy to be presented by HR Director David Collier. Good morning, David.
Good morning, Chair Hall and Commissioner Jacobson. For the record, again, I'm Human Resources Director David Collier. I bring before you a formalized policy for bilingual pay. The county has had, I guess I would say, an informal but consistent way of doing it, but we did not have a formalized policy. And I had gotten some research and then did a little bit more research, and it also showed that what we were paying our folks that were bilingual was really behind what some of our other comparables were doing. So I also worked with Health and Human Services because there is a new requirement that's coming up in regards to House Bill 2359 that changed the requirements for healthcare interpreting services. So we added those designations in here, and those are the certified medical interpreter, or CMI, and the qualified medical interpreter. And the difference between those two is the certified also is oral and written, whereas the qualified is just written. So there's two tests for this for the certified and one test for the qualified. We currently have a couple of individuals that I believe three actually that are working towards the qualified interpreters designation. But we have actually 15 individuals at the county right now that are receiving the medical stipend. When I did the comparison of the $70 a month that we have been paying individuals to what I am proposing, which would either be 110 per month for just somebody that could interpret, whether and has that proficiency. So maybe maybe like in the roads or in the sheriff's office where they don't need that one of the certifications, they would get 110 a month. But the qualified medical interpreter would get 160, and the certified would get 210. And I discussed that with Director Romero of Health and Human Services, and we thought that it was good to have a little bit more of a difference between those to really reward somebody for getting to that next step. And that kind of happened after I had some conversations with some of you in regards to that. So I also in here did put basically an option for somebody who has, maybe they have American Sign and Spanish, that they would get an additional $44 per month for having that additional
Third language.
third,
Yeah.
second language,
Yeah.
really, because if they, and that is something that it is a little uncommon. A lot of places don't recognize that, and I'm assuming that it's probably more so because they don't have a lot of people that have the two. But again, I think based on the conversations that it definitely is good to allow somebody that ability. So I don't know if you have any questions.
One question I had and looking over the pack is, I like that we kind of make that that special rate for true medical interpreters. And I guess the other question I had thinking about this is, I believe, and I could be wrong, but I believe there is a kind of same type of certification for legal interpreters. And I know that the courts, you know, the state has their own, but I don't know if through the DA's office, if there's ever legal interpreters or.
So actually, you had mentioned that to me, and when I was looking actually under the, I believe it's under both the certified and the qualified. And forgive me for not remembering if it was both or not, but the court recording is actually one of the tests that can be passed to get to these levels.
I see.
So-
Okay.
So it actually was kind of covered in there.
Okay.
So.
Great. Thank you. It's my only question.
Okay, I don't have any questions. I know we met to discuss this one-on-one more than once. I think it's an important step, and I think having employees with bilingual ability will only become more important as time goes on. And so thank you for the work on this and your team.
Thank you.
Yeah. And can we just put this on the consent calendar for next week or?
I'm fine with that.
Okay, I'm fine with that.
So we'll note it for consent next week.
All right. Thank you
Thanks,
very
David.
much.
Thank you.
Transfer donation of property to Habitat for Humanity for the creation of affordable housing. Mr. Gardner.
And I'm gonna text somebody on the phone and tell him to queue up. Is he in there yet, Casey?
Yeah.
Oh,
on
he's
the
there.
screen.
Okay, never mind.
So I'll do Brian Gardner, Assistant County Counsel for Lincoln County. I'll do a brief presentation, but then there may be, if there's specific questions about the plan and all, that's we may have some other people online for that. It's been about 3 years, I think, since the Board of Commissioners has transferred a property for a purpose such as this. So I wanted to go over that process a little bit. ORS 271.330 allows a government agency such as Lincoln County to, once they have taken a property through tax foreclosure, which this subject property, what we're talking about, that's how we attained this property. They can, there's choices you can have. You can either put it for foreclosure sale, but there's also other, it can be donated, subject to three specific categories, one of which is low-income housing, which is what this proposal is for. It can also be donated for social services or childcare services. The statute requires a reversionary interest to ensure that the property is used as required by law for this type of transfer, and also as in the way that the county would want it to be used based on the donation. The subject property that we're looking at is again, it was taken through foreclosure. The address is 4220 Salmon River Highway. Some of the things that I know for sure about it are, it was about, when it was foreclosed on, there was about $2,500 in delinquent taxes over the years that opened it up to a foreclosure action. It's about 0.52 acres, and the assessed value is $54,950. Basically, what I was approached with to look at is a transfer of the property to Habitat for Humanity. for the purpose of providing a low-income housing as a small but meaningful contribution to address the affordable housing needs of Lincoln County. Some of the issues that I looked at, and considered when drafting a draft agreement that had the reversionary clauses would also require that it be utilized in the way intended. So basically for low-income housing. So it has to be prepped, and there has to be a single-family dwelling on it within 5 years. But the other issues are to Lincoln County, it doesn't do us any good to have foreclosed properties on our rolls. We can't improve them. We can't do anything with them. If they're foreclosed on, we basically have the options of selling them, keeping them, but not being able to do anything with them, which can create a liability issue, getting it back in the tax rolls. And with this proposal, having some assurance of it being developed in an efficient and speedy process.
Okay, and we have someone else to present about
Yeah,
this.
so I think Brian covered the legal part of this really well, but this project is a little bit different because we actually have the state who's going to work with Habitat to actually rapidly develop this for a fire survivor that meets the low income requirement. So I think we have Tom Kemper, who's a housing consultant that's hired by the state to assist with recovery efforts, and maybe Tom can kind of talk about the state's commitment to this.
I do want to point out, I do notice that Lucinda Taylor's.
And Lucinda's here as well. Yeah.
Good morning. My name is Tom Kemper. I'm a real estate developer and investor. Been an affordable housing developer for over 3 decades. I've been engaged by Oregon Housing Community Services to help them create interim and permanent housing in the wildfire impacted counties, including Jackson, Lincoln, Lane, and Marion counties. And my partner and I, Bruce Wood, have been, sort of diligently working for about a year in that endeavor. We pursued, manufactured home parks, tiny home villages, and other housing alternatives. The state entered into a contract to acquire 140 modular units. So those are sitting either in Jackson County or in Idaho, and the state's very interested in getting those placed as soon as possible. One of the things that they've committed to do is to fund that the development cost and the donation of a modular unit to two units in Lincoln County, and preferably in the Otis Burn area. And the intent is that we would actually donate the modular unit to a local nonprofit and provide the funding for getting it placed, because you have to put in the infrastructure and create a foundation to actually sit it on. And OHCS is funding the development costs and providing the modular unit, and it's dedicated to a wildfire survivor that would have a household income of 80% or less. And the sort of the critical issue is it has to be done very quickly. The expectation is that this would occur within 2 to 3 months, and we're pushing Habitat to actually perform that. And I think Lucinda can sort of fill in what she's been working on. I think she's engaged a contractor to sort of get the ball rolling on making sure the infrastructure is there and the creation of a foundation to put the mod on. So Lucinda, you want to talk about that?
Sure. So Thomas, we probably haven't connected totally on all of the loop. The 2 to 3 month timeline is not completely feasible because this property we have confirmed that we would have to go through the quiet title process on this property to be able to get title insurance on it, and that'll take 3 months. So
Okay, so
but as soon as that process is done, we would be ready to have our contractor already in place and all of the permits in place and everything rolling concurrently to be able to get it moving. The one piece that I didn't hear you mention was we would also have to do a septic system because that area is not on any kind of a city water system. So some septic and some other items that we'd have to have in place there. But we are, the board has approved of this project pending appropriate land donation and contract with the state. So we are ready to move forward and make that commitment, assuming all the pieces fall into place.
Just to be clear, when you refer to the board, you're referring to the Habitat for Humanity Board?
I'm sorry. Yes, absolutely. Habitat for Humanity Board of Directors. Yes. So I'm just saying on our side, our organization is fully informed and they are ready to, as soon as we have an official offer, if one were to be forthcoming from the county on a piece of property, they are ready for an email vote to be able to approve accepting that property. And they are ready for, once there is a contract ready with the state, to be able to approve that contract as well.
So we can get the grant agreement in place within weeks. So that's not an issue.
Yes, we can get all of the agreements in place as soon as we are still working on getting a final estimate on that work. We've had a few folks out, as you can imagine, over the last couple of weeks with some COVID issues. So we're a little slowed down on that, but we're confident we'll be able to get that ready within a matter of weeks.
No more questions for me. I'm just excited to hopefully see this move forward.
I am too. So I would be happy to move this forward. Should we make it a decision action item next week? Okay.
So that's what I would anticipate as a decision action. What I will do is I will finalize the agreement, send it to Lucinda. Hopefully they will have it executed on their side before August 3rd. And so that we would have a decision action as well as execution of documents so that everything, I'll have the quitclaim deed, the agreement and the resolution ready for August 3rd.
Excellent. Thank you very much.
Thank you, Tom and Lucinda. Appreciate it.
Thanks.
Thank you.
Okay, we'll move on to our next agenda item. State of Oregon Coronavirus State Fiscal Recovery Fund Grant Agreement for Cougar Creek Culvert Project. Say that fast 3 times, Mr. Kenyon. Cougar Creek
I
Culvert.
can't. Not
Okay.
even gonna try.
Okay.
Good morning, Commissioner Hall and Commissioner Jacobson. What I bring to you today is, as Commissioner Hall said, I'm not gonna try to repeat all of it, but it is a grant agreement with the state of Oregon through their Coronavirus State Fiscal Recovery Fund.
I'm just super excited to finally have this agreement.
And
here.
You've been
And
putting
I-
away at this for a while.
Yes,
haven't
I
you?
have.
And I would like to actually thank Commissioner Jacobson, who was instrumental in securing these funds for this project. It would not have happened without her help on this. Cougar Creek is a tributary that crosses Buck Creek Road, County Road, up in the Five Rivers area. And currently there is a corrugated metal culvert there that is well beyond its life, and it's been something that's been on our radar for quite some time for replacement. It's also been listed as a high priority salmon stream with the Department of Fish and Wildlife, and so it's been on their radar. And we were actually currently working with Midcoast Watershed Council on a replacement project, but we were lacking the funds to do so. And so with Commissioner Jacobson's help, we actually was able to secure the funding to do the project. So this is a win-win for everybody. The corrugated metal pipe is about 11.5 feet wide and 6.5 feet tall. So it's a fairly large pipe, but because of its placement, because of its deterioration, it's no longer passable for fish. So we're going to replace it with a precast concrete arch that's going to be 24 feet wide and 11 feet tall. So, and what it does is it creates an open bottom. So there's a natural passage for the fish, and it's going to open up an extreme amount of a stream above that for spawning for the salmon. And so it's a win-win. What I have here is the agreement, and the agreement is for a grant amount of $1,447,650. The total project cost is old estimate was estimated at $1,682,650. Now, by the time this project goes, that may be back to a realistic amount. This project is not scheduled to actually happen until next year in the in-water work period, which will be sometime between July 15th and September 15th of next year. We haven't begun even the process for putting the project out to bid because we haven't secured the funding yet. And this is the last step to do that. So what I'm asking from the board is to sign the agreement so we can basically get all our paperwork back to the state, secure the funding, and so that we can continue on with the project. The grant amount is for 1.4. The road department did agree to throw in some match money. That's pretty typical of all our projects. And also Mid-Coast Watershed Council secured a smaller grant that they're actually going to throw in approximately 80,000 for engineering costs and some other things. And so we'll spend their money first and then spend our money second.
Okay.
So
Anything else?
I guess one question I have is with the rising cost of construction and stuff, and we're probably a year out for the in-water work period this time next year. Do we still think our original cost we put in for the project is going to make it?
It will be close.
Okay.
And what the plan is we will go out to bid next spring. We will get a cost estimate on the project. Then if we are short money, the road department will actually throw in a bigger match to make that happen.
Okay.
Because this is one of those projects that without this funding, most likely wouldn't happen. We can't afford not to do it. So even if we have to throw in another couple extra $100,000, it is so well worth our time and our effort to get this done that's how we would take up the difference.
Okay, good. I'm glad to hear that because there's been a big issue with a lot of these projects. This was actually approved 18 months ago. And then I won't get into the huge long story, but there's a huge long story to actually getting it to this point with the contract. And so, there's been a lot of issues with what projects were costing at the time it was funded versus what it's actually costing to do it
Right,
now.
and there
So,
was also a contingency put into this dollar amount. So that may actually soak up the difference.
get us
in
there.
itself.
Okay,
So
good.
the other thing is as Commissioner Jacobson stated, this process started quite some time ago. And on the agreement, Commissioner Hunt is listed as the chair and it asks for his signature. Now I know that Commissioner Hall is now the chair. Assistant Legal Counsel Herbage, who went over the document, did say that it is appropriate to scratch out the Doug Hunt's name, put in Commissioner Hall's name for that signature. And it's not that it's super time sensitive, but we had 60 days to get the process done. We're basically at about 30 days now. And so by the time we get the signature, if that happens next week and we get it sent back, we should have a couple weeks to spare. But
Yeah.
I have no questions. My only comment is congratulations, Commissioner, for your hard work to make it happen. And I'm certainly fine with moving this forward to next week.
Consent.
Okay.
Yay.
It is a satisfying
It
feeling
is a
when something
satisfying feeling.
you have worked on for a long time finally comes together.
I want to sign the culvert. When it gets here.
and we can spray paint under.
There we go.
There
Okay.
you go. Now we come to reports. First
you.
up, Commissioner
Thanks.
reports. I don't have anything to share today. Commissioner Jacobson.
Right before this meeting, Casey and myself attended our technical assistance meeting for affordable housing. This was a project we qualified for through FEMA. from having a wildfire. And so we are in the middle of basically working through a project with a contractor at looking at how we, what are the barriers for workforce housing, not low income housing, but workforce housing? What are the barriers to getting more workforce housing projects here? And how do we overcome those barriers? So hopefully in the next several months, we'll actually have that report out, but exciting to see that work moving forward. That's my only report for this week.
Excellent. And only a couple of months till results. That's
They're on a tight, the contract that they're on with FEMA is a very tight
Okay.
timeline. So it should be, a draft should be in a couple months and then the
Wonderful.
final should be after that. So, yeah.
wonderful. Now we move on to our monthly COVID-19 report to be presented by Public Health Director Florence Portal. We have Florence on the line.
Good morning.
Good morning.
Everybody. All right, COVID update. And I also took the liberty at the end of the slide deck to put a slide around HMPXV-2, otherwise known as monkeypox. But let's start with COVID. Next slide, please, Casey. All right, the main updates for today, we are having bi-weekly meetings now with the state health epidemiologist at the Oregon Health Authority. And the latest conversation was, as you know, we can only report on the cases that are being reported to us as a public health agencies throughout Oregon. And we've had this conversation before, but because we've done a really good job at making at-home testing available to people, we think we are missing a lot of those reports through the public health authorities. So even though Oregon has about a daily case average of 1,400 cases a day, our state health epidemiologist and officer mentioned to us that pretty much we think that there is, for each one case that is reported to us, there is about 30 more cases out there that we do not know of. And the reason for this is a few. We've had this conversation over the years about the great adaptability of this virus. And so we're now dealing with BA.5, which is a variant of the Omicron variant of COVID-19. So we've experienced a major surge, as you may remember, in December, January last year and this year. And we thought, oh my goodness, Omicron is already like so much more transmissible than the previous variants we had seen. And this specific variant of Omicron is even more able to transmit. So some people are even saying, like, you are in a store, you're not wearing a mask, you're just crossing and sharing air with somebody who might be infected with this variant, you might catch it. The other piece of this variant, it is very good at I'm not going to find the word. It doesn't necessarily care about your immunization status, if that makes sense. It's very good at escaping your previous built immunity, either through previous disease or through previous vaccination. The good news is that, it seems like hospitalizations from this current surge might have peaked in the high 400s, which is so much better than what we've seen in the past when we were over 1,000 daily hospitalization in previous surges. Hospitalizations in Lincoln County are steady pertaining to COVID. We have between 1 and 2 cases in the hospital from time to time. And we haven't necessarily heard from our colleagues about any surging at this time. The other, yes.
I'm sorry, could I jump in with a question at
course,
this
yes.
point? Last Friday's News Times had a front page story about your division's projection that we probably have 3,000 active cases of COVID-19 in the county right now. And I don't know, at least the reactions I've been hearing that folks who kind of assumed the pandemic was over and that we were and that COVID had all but gone away, that was kind of a wake-up call to them.
Yeah. Yeah. And so pretty much we projected that number based on the conversation I was just having around the fact that we're only capturing the reports that are being done either in a doctor's office or, you know, at a lab, and we are not capturing the test results of people who are testing at home.
And I have a question about home tests. You know, there seems to be some belief in the community that with the current variant that home tests are not accurate. Is there any data to that claim, or, you know?
There is not, and I can give you a personal experience with this.
Okay.
I got COVID 3 weeks ago, and my home test was very positive. I think it's just a question of when you test. It's really important that you test at the onset of symptoms or just after the onset of symptoms, because this is when you're going to have the most viral load in your body, and this is when the test is likely going to pick it up. But I can tell you, like, I tested, so I had a family member who tested, and I started feeling that I had some, you know, sneeze and all that. Tested that night, was negative. Tested the next morning because I felt a little bit more symptomatic, was positive. So if I had waited, if I had just kept the result of the first day and be like, well, I don't have COVID, then I would have gone about living my life and transmitting COVID to all the people I would have met. But the next day, because I felt like I had a little bit more symptoms, I tested again and then was positive. And I can tell you the transmission went really, really fast in the household. Yeah.
Thank you for that.
Yeah, you're welcome. So I would say I think it's more of when you test rather than and we've said that from the beginning. There is no false positive, okay, with the tests, regardless of what they are. What there may be is a false negative or a test that didn't react quite yet so I would be more wary of that and how people use the test.
Thank you.
You're welcome. And then the other update is that there is a new vaccine on the market. This is not a mRNA vaccine. It's a vaccine called Novavax. It's more of a traditional way of producing vaccine. Oregon has received 24,500 doses. I believe we are expecting some, and we will carry those at our vaccination events like we've done since the beginning of our vaccination campaigns. We carry all vaccines, and we give people the opportunity to choose. At this time, it looks like the state of Oregon is not expecting to have another allocation of this vaccine. Next slide, please, Casey. Okay, so this is what we know of, what's going on, epicurve for the state of Oregon. So we've been steadily between about 1,500, 1,400 cases. Next slide. So in Lincoln County, we have gotten reports for 306 cases at this time. So obviously way less than what we were getting in January, February, but still a significant amount of reports. Next slide. So this is our weekly AP curve. So, from January of this year until the week of the 17th of July, and we are steadily at about 80 to 100 cases a week that we know of. Next slide. So this is the comparison over year, yeah, and over time. So 2020 in blue, 2021 in red, 2022 in yellow. So as you can see, when we thought we were overwhelmed with COVID, we are definitely matching those numbers and way more than the previous years. Next slide. Vaccination, we're still going steady. Obviously, we're not seeing as much demand as we've seen in the past, but I think we're still doing a really amazing job at vaccinating folks. Out of 50,000 people, we vaccinated over 40,000. So the team is still going strong. Next slide.
Florence, before we move on from that
Yeah.
one, just a notation, or I'd like you to confirm, people may remember that for a long time, our vaccine percentage was running around, I think, 85%, and is the fact that it's now at 78.8% reflective of the fact that the birth to 4-year-olds are now eligible for vaccine, and they weren't before?
Yes, when you very, very good. When you increase the denominator, therefore your percentage of population might decrease, especially when the 0 to 4 hasn't picked up quite yet.
But still, this is quite impressive.
Yes,
Yeah.
yes, I think it is.
Okay.
Next slide. All right, so this is another variation of what's been going on with vaccination, but as you can see, we've definitely been declining, but we're still around 200 to 300 vaccination a week. So this, this is still pretty significant. Next slide. So we have, because the demand is a little bit less, we have contracted a little bit the events that we are going to be providing in August, but we still, are going throughout the county and making sure that we are present for people when they are ready to get vaccinated, get their second dose, get their booster, get their second booster, try the Novavax. So we have events in Newport, in Walport, in Yahat, in Toledo, in Lincoln City. So we will maintain our strategy of outreaching and engaging with the various communities in our county. Next slide. Okay, so this is the same sheet of music. No, COVID is not over. Yes, if you're inside, please wear a mask to obviously protect yourself and those around you. As mentioned before, the virus is great at adapting, and BA.5 is extremely good at transmitting. Symptoms from COVID: a cough, a fever, shortness of breath, difficulty breathing, fatigue, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, diarrhea. All of this are either or, not necessarily and especially for those of us, I think who've been vaccinated, you might just have one of the symptoms going on at a time. So obviously stay home if you are sick and wait until your symptoms resolve before you get social again. Take care of yourself, get tested if you can as soon as symptoms start. I just want to remind everybody that we have 2 testing clinics a week in front of the Nye Street building in Newport. It is free of charge for anyone who would like to come in. We also have a lot of at-home test kits that we have been distributing through very many partnerships in the county, especially our libraries. So people can also go and get them there free of charge. Yep. That's it. Next slide. So now the question is, would you like me to stop here or would you like to discuss HMPXV, otherwise known as monkeypox? Is it of interest, or I didn't know, so I just wanted to see.
Yes,
Yeah? Okay.
we would like to hear about monkeypox.
Okay, so one thing that I learned yesterday when I was listening to Dr. Tim Menza from Oregon Health Authority is that apparently we're trying to get away from naming that this is monkeypox, as it is considered maybe othering and discriminating. So I'm going to try to put out there the other name as much as I can, which is human. So H stands for human, and then MPXV. So I did my slide deck prior to listening to the presentation, so apologies for that. I know it's a mouthful, but I'm going to try to follow the lead of our authorities. So as of Friday, so last Friday on the 22nd, we had 41 cases in the state of Oregon. Those cases are currently in Multnomah County, Clackamas County, Lane County, and Washington County. So mostly the Tri-County area and Lane County. So this virus is not new. It is, the way it's spread is mostly through a close, intimate contact with someone who has monkeypox. So it's not necessarily mean that it is a sexually transmitted infection, but what it means is during sex, you have those close contact, and therefore this is where it's more likely that the transmission is gonna occur. There is vaccination available for this disease. However, there is a current shortage of vaccines. And so that's going to remind you of COVID, but the CDC and the Oregon Health Authority are phasing in the vaccines and really focusing the administration of those vaccines on communities and population who are the most at risk and the most vulnerable to the disease, and for whom the benefit to get vaccinated is going to be higher. Right now, the guidelines are if we get a case, which we do not have a case in Lincoln County at this time, but if we get a case, obviously we will investigate that report right away, do some contact tracing, and hopefully identify contacts, and then we will get a delivery of vaccines from the Oregon Health Authority and be sure that we will be able to do post-exposure prophylaxis to the contacts we've identified, and obviously the case that was reported to us. So the other piece that I wanted to highlight is there is a really great resource that is being developed by the Oregon Health Authority on this virus. And I put the website link on there. It is www.oregon.gov/orthopox. I also wanted to mention the steps we are taking locally to prepare in the event we are going to get a case, because it thinks it's just a matter of time. So, you know, we're going to set up our case investigation and contact tracing team. And I also want to do a lot of outreach and engagement of the populations that are most at risk at this time for getting this disease. And just like be ready to handle the response when we have a case. That's what I have.
Questions or comments, Commissioner Jacobson?
Thank you for adding this update, Florence. I really appreciate that. Actually, it's been kind of something I've been thinking about, so thank you. And I actually have a question for our county manager, Tim, about this. So as I think Florence's response is totally correct, which is kind of prepare and get ready for this coming into Lincoln County. Are we able, or do we have guidance if we can use ARPA money for response to this particular virus if we needed it, like for an extra contact tracer or something?
Not at this point.
Okay.
Specifically related to COVID.
All right, thanks.
What I can add is we have gotten information from OHA that we can use one of the COVID funding that we still have available just for the immunization part of things. And I need to confirm with the state that if we could use other funding streams for COVID. So I'll let you know.
Okay, I just want to make sure that you have what you need to.
Not
deal
yet.
with this. Yeah.
Okay,
Okay, not yet. All right, let me know, I guess, what you find out. Yeah.
That sounds good.
All right, I don't have any further questions at this time. Thanks for the informative update.
You're welcome.
We'll see you next time. Now we move to public comment on the agenda. If you are online and wish to offer public comment of up to 3 minutes, please use the raise hand function on Zoom. And earlier, Mr. Miller, you said no one had submitted written testimony through Smartsheet before our deadline for this week. And it doesn't look like we have, we've only got 3 people in the room. They're all county staff. So it looked.
Yeah, we did have people that were here. Did they leave something to be read or?
Nope,
Okay.
just some recommendations for identification when people are speaking.
Oh, okay.
Oh, okay.
Yeah, nobody signed in.
Okay, then at this point, we can recess into an executive session under ORS 192.660 subparen E regarding real property transactions. If we have any members of the news media present, they are allowed to listen in, but not to report on the content of the discussion.
Chair Hall, just a quick question. We passed on the decision action item. Is that?
Oh, that's right.
Well,
did we find
that's so
someone?
Jerry, we're going to adjourn an executive session and then we're going to come out of an executive session. And so I anticipate that item can be addressed then.
Okay.
I actually would like to take a short break too.
Oh, okay.
Before we go into executive session.
Okay.
So we can discuss that.
So we're in recess and we'll reconvene in executive session in a few minutes.
So do we, Casey?